new Dr. Phil.
What's your point of view here, and what do you think people need to be alerted to?
Well, first of all, I know so much about marijuana because it was my first drug. I thought it was something that I could smoke and be okay and do the things that I wanted to do. But what happened after that is that it led me to do other things and worse things, and I've been clean from any type of drugs for 11 years.
Right.
Now, recently, my daughter was very distressed. She was scared to talk about her mom having 60-some plants growing in the garage that she was able to see, and also she was smelling a lot of marijuana in the house, and she knew that it was bad. And then her mother told her not to talk about it, that it was fine, it was for the good people. These are patients, we're trying to help them, it's not for the bad people. But do you think it's appropriate for a 10-year-old child to know about the good stuff and the bad stuff, and then one day that child is going to turn out to be a teenager and going up to the mom and say, you know what, you've been telling me it's good for me, so give me some. Because I want to smoke some too, because I can't sleep at night and my back is hurting or whatever.
Right. And you disagree?
I absolutely and completely disagree. I think this is really a custody issue versus a medical marijuana issue. When I started using cannabis legally as a medical patient in 1996, it was under the supervision of both my medical doctor as well as my psychiatrist. And they were the ones that recommended it to me over taking 80 milligrams of Prozac a day, Xanax, Halcyon, and so forth. So for me, it worked better as an alternative to opiates. And I was able to get off of all pharmaceuticals.
Okay, but he's not debating that. What I hear him saying is exposing children to this at a young age and creating confusion in them or over accessibility to them predisposes a comfort level with starting that drug, which could be a problem with other drugs and later in life. Am I getting you?
Absolutely, doctor, absolutely.
Okay.
What she's trying to say, I understand, because she's all for the marijuana, and I'm okay.
I'm for the responsible adult use of cannabis,
so you think,
medical cannabis,
right,
with a license as a patient, not for people with
so
addiction.
Would you smoke it with a 10-year-old child?
Absolutely not, but I will tell you, when my children came home...
Would you smoke it in the next room and then bring it over here?
Could I finish my sentence, please?
But we're talking about different things. We're talking about two different things. I smoked it, so my daughter at 10 years old being confused is making me think as a father, as a caring father, going, wow, maybe my daughter someday will come back and go, my mother is selling it, maybe I'll smoke it too. So what do you say about that?
Well, I firmly believe that we're talking about parental responsibility. I'm a mom. I would never, ever be a proponent of a child using cannabis that was not prescribed by a real doctor.
I understand that.
It shows the need for regulation.
Oh, wow.
And that's the big problem.
So.
I'm also for the rights of children. I mean, our children absolutely must be protected. I have 2 daughters of my own.
All new Dr. Phil.